Okay, so now Ermie's going to present our patient that we had that was a hemorrhage.
Mrs. P was admitted December 21 for induction. She's a gravida 8, pair of 3 living children, ages 8, 18, and 21. She's 41 years old. Except for advanced maternal age, pregnancy was uncomplicated. She's O positive, all other labs are negative. She came in admitted eve of December 21 for Foley bulb and Pitocin induction. She's 39 and 6 weeks. Of course, it's an elective induction. Doctor examined her at 12:30. Patient was 4 centimeters dilated and coping well. An intrauterine pressure catheter was placed to monitor the contractions accurately. A short time later, she called out complaining of feeling pressure. On vaginal examination, she was 10 centimeters dilated. They set up for the delivery. Delivery was quick, and a baby girl was born weighing 7 pounds with Apgars of 7 and 9. The placenta delivered quickly. Mrs. P at the time started to bleed heavily. Fundal massage was done vigorously. IV Pitocin bolus was started. D5 LR or LR with 20 units of Pitocin. The bleeding continued. Methergin 0.2 milligrams was given IM. Bleeding continued. Cytotec 800 micrograms given rectally. Bleeding continued fundal massage. At this time, they're trying to start IV lines to no avail, cold anesthesia, and blood bank for blood transfusion. Hemabate 0.25 milligrams given IM. Bleeding persisted. Despite of the above uterotonic drugs and IV fluid resuscitation, bleeding persisted. Patient was taken to the operating room for emergency hysterectomy. At this time, vital signs were non-palpable. She was taken to the operating room. By the time she was on the OR table, she was unresponsive. The code team were called, and the OR team. The physician had started the surgery even before the team got to her. After surgery, she was transferred to ICU. Mrs. P had DIC. She had received multiple units of blood products, including red blood cells, fresh frozen plasma, and platelets. She was given 28 units on the right-hand side, if you can see, of red blood cells. What do we know about red blood cells? Red blood cells make up about 40% of the blood volume. Essential components of the red blood cells, hemoglobin and hematocrit. Hemoglobin makes up about 30% of the red blood cell, hematocrit 40 to 45%. As you could see on the patient's admission, hemoglobin on December 21, hemoglobin is 10, hematocrit is 29.6. Value for hemoglobin for women is 14 grams per deciliter of blood. Hematocrit depends on the age of the individual. Adult women is 38 to 46%. If you go down below 13.7, 5.2 was hemoglobin, and hematocrit is 16. Platelet on admission was 128. Platelets help the clotting process by sticking to the lining of the blood vessel. Normal value is 150 to 400,000 per microliter. The PT and the PTT, the blood test that measures the time it takes for the blood to clot. The prothrombin time, normal value is 25 to 35 seconds. As you can see, her PTT is greater than 75, which is a minute, 15. And the partial thromboplastin is measured in seconds, 11 to 13.5 seconds. Fibrinogen is found in plasma. It helps blood clot to form, which in turn helps stop bleeding. Normal level for pregnant women is 301 to 696. Patient was given 5 units of platelets, fresh frozen plasma is 4, cryoprecipitate is 9. What is plasma? Plasma is the liquid portion of blood, plays a critical role in maintaining blood pressure. Plasma is derived when all blood cells, RBC, WBC, and platelets are separated from the whole blood. Fresh frozen plasma is a plasma taken from a unit of whole blood frozen within 8 hours of collection. Cryoprecipitate is a frozen blood product from plasma, often transfused as a 4 to 5 units pool instead of a single product. The ratio that was given, 5 platelets and RBC, and the cryoprecipitate, if you look at her platelet, which is 44 at one time, and the PTT is 33 at 137.5. And on December 23rd, she was given 5 units of platelets because her platelet count was 62 and hematocrit is 21.7. And on December 25, she was given 2 platelets of 52, hematocrit is 26. Her hemoglobin is still like within the normal limits for her anyway. On December 26th, she was given 1 unit of red blood cells and 3 platelets. There's evidence that to give massive doses of the clotting, which is the fresh frozen plasma and cryoprecipitate to the RBC, helps with the patient who is in shock. The patient has acute renal disease. She was also, because of repeated intubation attempts, tracheostomy was done and was decannulated prior to discharge.